In this video, we'll talk about the treatment of anterior crossbite. First of all, we'll discuss various factors which influence the treatment of the anterior crossbite. To remember them, you must remember soft with double T and N, soften. So by S, first of all, we have space. Now, if there is adequate space present, the treatment is initiated. If there is inadequate space, so first the space is gained prior to the treatment. Space gained prior to treatment. Now, how is the space gained? Is either it is gained through a finger spring with removable appliance. It basically opens up space for labial movement of tooth in crossbite. Now, second modality of treatment could be an open coil spring along with orthodontic appliance. Now, if there is a severe case where there is severe crowding and there is very less space, in cases of severe crowding or moderate crowding, what we do is we do extraction of teeth to gain space. This is explained in model analysis, on which I'll make a video soon. So this is the space factor. Now by O, what we have is overbite. Now initially, if there is an overbite which is present, it is first basically prior to the treatment. So it is corrected by using either tongue blade. Alright, we will discuss it in detail. Now if it is present after the treatment, now in case it is present, so what happens is we will see that it basically inhibits the chances of relapse. But if there is little overbite or open bite present, then we see that there are increased chances of relapse. Alright, now coming on to the F factor, Now this is the functional shift of mandible. Shift of mandible. Now what we do is we ask the patient to occlude anteriorly, and if the patient occludes anteriorly and it is positive, so we see that there is a good prognosis. However, if the patient is not able to do so, so we render that it is going to be a bad prognosis, and we treat the patient accordingly. Now coming on to the next factor, which is T. So basically type of movement. Now if we want a tipping movement, then we will use a removable appliance. But if we want a bodily movement, we will use a fixed appliance. We will discuss about these movements in biomechanics or mechanics of tooth movement. Now coming on to the second T, which is the torque. So maxillary incisor torque. Now what we see is in maxillary tooth, if the roots are far lingually, so the roots to move labially, they are moved labially by torquing to move labially. Alright, whereas if we see in the if they are maxillary anteriors, if they are lingually inclined, now if they are lingually inclined, it is a good prognosis and it is easier to treat lingually inclined rather than bodily displaced. Alright, so S, O, F, T, this is the fourth factor. Fifth factor, soften. So by N, the number of teeth. An increase in the number leads to an harder treatment modality. Now let's discuss the treatment options for the anterior crossbite. Now the first one is the use of a tongue blade. Now in this, what we do is this is usually used for the developing single tooth anterior crossbite. Now there should be sufficient space for the tooth to be brought out. Alright, now in this, what we use is we use a flat wooden stick. Suppose this is our maxillary teeth and this is our mandibular teeth. Alright, now what we do is so since we have this maxillary tooth, we will put a wooden blade over between them. So basically it is placed inside in such a way that it contacts the palatal aspect of the tooth in the crossbite. All right, palatal aspect of the tooth in the crossbite. Now, what we do is we ask the patient. The patient is asked to rotate the oral part of the blade upwards and forwards 1 to 2 hours for 2 weeks. Now, what we see is this thrusts the upper teeth in forward direction, all right, and it relieves the anterior crossbite. Then we will see that this tooth, oh my god, this tooth will come forward from the mandibular counterpart, all right, first, second and third. In this, what happens is, this can be usually this is all used in developing ones. In case there is a mostly developing crossbite and we have recognized it at an early stage, so it can be resolved through the through this option of downgrade. Now coming on to the second appliance that we use is the Catalan's appliance. Now this is the second appliance, Catalan's appliance, or we can also call it as lower anterior inclined plane, or we can call it as reverse crown. Now over here what we will see is, suppose this is our tooth, this is the scene right now. All right, now what we do is, suppose this is the tooth and this is our mandibular tooth. Now here what we see is there is an inclined plane. All right, now I'll explain it. Now in this what we see is, basically we use an acrylic or cast metal. This is basically employed for single or segmental crossbite. All right, now in this what we do is, there is an inclined plane. It is designed to have a 45-degree angulation. Now this what happens is, with this it leads to a reverse crown effect. Okay, reverse crown effect, this is the keyword here. Now this leads to a forward thrust of upper anterior, all right, and then this releases the tooth from the crossbite, Now indications: when there is adequate space present for alignment, also when there is a palatally displaced maxillary incisor. Now it is not used when there is the basically the disadvantages. In disadvantages, first one is when there is a problem in speech during therapy. Now put up with dietary restrictions. Now if it needs more than 6 weeks, because this anterior open bite is basically due to the supra eruption of the posterior. Also there is the frequent need for re-cementation. Now coming on to the third modality of treatment, which is the use of double cantilever spring, which is the Z spring or the Z spring. This is used in deep overbite. Now what we see is when there is an adequate space present. Now in this what we do is, over here this we can see we give a Z spring. Also we can give Adams for retention of the appliance. All right, now this is basically to labialize the tooth in the crossbite. Now suppose there are reasons which are skeletal for anterior crossbite. So skeletal Crossbite. Now in this, what we can give is protraction face mask, because it will cause the protrusion of maxilla. This is basically during the growth periods. All right, we cannot give them in adults because these are myofunctional appliances. Uh, okay. Now we can, because these are, sorry, orthopedic appliances. Now coming on to, we can also give for mandibular growth, basically to decrease it, so we will give a chin cup. All right. Now fixed appliances. In fixed appliances, we can give bite planes, posterior bite planes. In this, there is a treatment modality in which there is a posterior bite plane which is constructed out of GIC. Now due to this, it restricts the uh, posterior crossbite, due to which there is the relief of the anterior crossbite. All right. Now I'll just draw a flowchart to sum up all what I've discussed in the entire video, so that it is easier for you to recollect. Now suppose there is an anterior crossbite. All right. Now first of all, we will evaluate in centric occlusion. So we will evaluate in the centric relation. Now if there is a class 1 molar relation and canine relation with only incisors in crossbite. Okay. So this is basically class 1 malocclusion with dental crossbite. So the first is, if we have primary dentation, so we will remove the interferences. If we are in a mixed dentation period, so we will think of giving tongue blades, Catalan's appliance. Okay. Now if there is if they first we'll give removable appliances, but if the case is severe, we can also give the fixed appliance. All right. Now if it is the secondary dentation or the permanent dentation, basically in this we will have to go through a fixed comprehensive therapy with bite planes, relieving occlusion. Now if there is a class 1 molar relation with canines, but incisor can be brought edge to edge. So basically this is functional shift. So it is pseudo class 3 malocclusion. So we remove the occlusal interferences and hence it is corrected. Now if it is a class 3 malocclusion canine relation with negative aspect, so basically it is a true skeletal class 3 malocclusion. So there is no active treatment in the primary phase of dentation. If it is the mixed phase, we can give interception by reverse face mask, chin cap or chin cup therapy. But if it is permanent, then we can do camouflage. But if it is post permanent, so we have to go for orthodontic surgery. Now if in this stage it does not correct, so not corrected, we will follow this. So I hope this video was beneficial for you to understand the anterior crossbite treatment, and further I'll also discuss about the posterior crossbite. For posterior crossbite I'll be making another video, so thanks for watching.